So I'm Dr. Zhao Jing, and I'm a consultant neurologist practicing at Mount Elizabeth Orchard Hospital. Today, my topic will be on headache and its association with stress and how it affects one individual in the workplace. So without further ado, I'll talk about headache today. The main purpose of it, is actually to empower the audience on how to manage headache. Exactly what is it about, how it happens, what's the cause of it, and how do we manage it long term. So here we have a testimonial from one of my patients, and it's actually something that I do see it every day, where patients sometimes describe their headache that is so severe that it's affecting their life. So if you look at the slides, it says here that the patient has difficulty leaving her bed, let alone her home. She cannot go to work for almost half of the month, and she cannot enjoy playing with her children or even meeting friends for coffee. So actually that's very common. I actually do have a lot of patients that sometimes they actually have to revolve their life around the schedule of their headaches because they cannot predict when their headache can hit, and they actually cannot function whenever their headache hits. And I believe that some of y'all in the audience may be experiencing something like that, or y'all may actually have witnessed colleagues that are having headaches that are so severe that they cannot function at their workplace. So the burden of headache is actually quite high. If you look at in one of our publications published in 2018 in Straits Times, migraine itself, the sufferers, can cause Singapore to have a yearly economic loss of almost 1 billion. So that's actually not just because of the burden of it in healthcare, but it's also because of the burden when patients cannot go to work, cannot function as a wife, cannot function as a parent to take care of their children. And if you look at the charts on the right side, you can see that women actually have a higher prevalence compared to men, and they are about 3 times as more likely. And this is because actually headache do have a high association, specifically for migraine, high association with female hormones. So if you look at the chart, roughly around the menarche period, which is when girls start to go into puberty, they will actually start to have a higher prevalence compared to males, and eventually these will actually taper off around the menopause period. So this is how prevalent headache is. So today I'm going to tell you all firstly what is the concept of headache and how do you differentiate it. So headache, is a symptom. It is a symptom where a patient feels pain anywhere that is above the head. And having that symptom, there are actually hundreds of conditions that is under the symptom of headache. And those conditions can be largely divided into primary headaches and secondary headache. So for primary headache, is actually the vast majority of what the patients are experiencing, and the most common one will be that of migraine as well as tension type headache. So today when I use the word headache, it's actually interchangeable with migraine and also sometimes perhaps tension headaches. And secondary headache, is the job of us doctors as a headache specialist and as a neurologist to rule out a secondary headache. So secondary headache, is basic conditions where there are other conditions such as tumor, stroke that is causing the headache. And usually this is done through a clinical consult as well as a brain scan. So clinical consults in our room, usually what we do is basically history taking as well as a physical assessment. And from there, I will assess whether you have a risk of secondary headache and whether there is a need for a brain scan. So these are some of the things that we actually look out for during a consult to see whether you have any red flags that can cause headaches. It is kind of like in our mind a re-stratification. You can look through it, but in the broad category sense, we actually look out for patients that have a new onset of headache in the older patient, the headache that tends to be more sudden and abrupt and tends to be more persistent thereafter. Sometimes we look for whether there are any past medical conditions that can predispose the patient to a more sinister cause of headache. So that will include a history of cancer, whether they have a history of headache that accompanies, history of fever that accompanies the headache, whether there are any other symptoms that come with it, such as weakness on one side, or whether there's any sensory symptoms. Sometimes we also look for headache that tends to have a bit of a pressure-like symptom. So what I mean is that when the headaches seem to come more severely when they are coughing, sneezing, when they are lying down in bed, and when the first thing when they wake up in the morning, they actually experience the headache. So that's when we are a little bit worried about whether there can be any tumor or any raised pressure inside the head that can cause the headache. And concurrently, there are some other things that we look out for. So that will include whether the patient is pregnant or whether there is an overuse of painkillers. While there are red flags, right, there are also white flags. So in my clinical consult, right, sometimes I actually flash these slides to my patient because I think that it helps to reassure them a little bit. But of course, on my duty, on my side, is to make sure that there is no red flags from the patient that I can elicit. So some of the white flags actually include a patient that has a long history of headaches, when their headache tend to be more intermittent in nature and tend to progress over time. So let's say if it tends to start during their childhood or adolescence, and then over time it goes away and then it starts to come back again. They may have it like a few months in a year and then it goes away again. So that's the intermittency that tells me that it might be more of a primary headache rather than a secondary headache. And of course, location. So actually there are some questions that have been posted by the audience where, the headache tend to run around the head. How come sometimes it's on my neck region, sometimes it's at the front of my head, sometimes it's both sides. So that is very confusing to a patient, but it's actually not confusing to me, because when I hear that, it's actually a reassuring thing to me that it's not something very sinister. So usually if the patient have a more location-specific headache that is always at that region and doesn't seem to go away, that's when I tend to be a little bit more worried. And lastly, if the headache comes with very well-defined trigger, so that will actually include triggers such as the very common one in female will be menstruation. During their periods, they will actually have a little bit more increased tendency for headaches. And that's actually very diagnostic of a condition called migraine, specifically menstrual migraine. And lastly, the very common one that is in the adult will be like stress and sleep deprivation, which is what we are focusing on today as well. So there are actually about three to four very common type of headache subtypes. One of it will be firstly the sinus headache. So this is usually experienced by patients when they have it during their flu period. And during that period, they will find that, perhaps when they lie down or when they are sleeping at night, when they are talking, they are coughing, they feel that there is a little bit more pressure around the forehead as well as the nose and cheek area. So that is very common in what we call sinus headache. Tension headache also can be very common. So this usually applies for people who have very prolonged screen time. If they wear a very tight headband or if they wear their helmets over time, that can actually predispose to a very tight band-like kind of pain around their head.